Okay, so let's talk about field epidemiology, what it is, and infectious disease. So, field epidemiology is the application of epidemiology under a set of general conditions. These conditions include that we have a problem that's unexpected, like an epidemic, a pandemic, or any outbreak. It also requires a timely response. Travel to and work in the field is going to be required to solve this problem, and the investigation time is likely to be limited because of the need of a timely intervention. So, if we think about the Zika outbreak in 2017, the epidemiologists had to travel to places like Miami to study people who were infected to try and figure out what interventions we could use to prevent the spread of Zika virus. Zika, for those that don't know, is primarily spread by mosquitoes, but it was also sexually transmitted. So we had to create interventions to both reduce the mosquito problem as well as limit the likelihood of sexually transmitting the Zika virus. So field investigations involve acute problems, acute meaning sudden, that may differ from conventional epidemiologic studies in three important ways. Field investigations often do not start with a clear hypothesis. Because they are sudden, they often involve an immediate need to protect the public and resolve the concern. So think about Zika, think about the pandemic of COVID. Field epidemiologists must also decide when the available information is sufficient enough to take appropriate action. How long before we take action is often dependent on when we decide we've learned enough about the disease or condition. So let's think about some terminology. So first, there's outbreak. Now, this word carries the same definition as an epidemic, but it's sometimes preferred because it's not as sensational as the word epidemic. But for all intents and purposes, an outbreak and an epidemic are the exact same thing. Now, when we think about field investigation, there are 12 steps, and we're going to talk about each one of those. So here they are listed, but let's go through them one by one. The first thing that we do is prepare for the field work. This means that we gather together our research teams and we decide who is doing what within those teams. We also begin a deep dive into the literature to understand as much about the disease or similar diseases as we possibly can. So if we think about COVID, we studied SARS and MERS in order to understand what we might expect to see with COVID-19. We then identify and contact the key people in the field. So this could include local hospitals, local doctors, local law enforcement, local EMTs, firefighters, and so on. Then we begin to prepare for the outbreak. So thinking about influenza, one of the things that we could prepare for an influenza outbreak is looking at the time of year, looking at seasonal conditions that would allow it to easily spread, and looking at places where people are kind of more concentrated. Those areas might have a higher likelihood of experiencing an influenza outbreak. Once we have assembled our team, we then need to establish the existence of the epidemic or outbreak. This means we then contact all local health officials and then we determine what the attack rate is. Now, as a reminder, the attack rate is the total number of new cases divided by the total population. So if we think about the flu, we would look at how many new cases of flu have appeared in the total population of an area. So Tallahassee has roughly 197,000 people, and let's say that we had 2,000 cases pop up, we would divide the 2,000 by 197,000. That would give us our attack rate. That tells us how fast this is growing in the population. Now, before we can treat anything, we have to know what we're dealing with, and this means that we need to verify the diagnosis. This often means we have to do a PCR test, tests that do blood samples, something to do a laboratory finding and a clinical assessment to understand what we're looking at. Most of the time, this requires specialty labs. Some of these are run by the state, others may be run by private corporations like Quest Diagnostics in order to actually determine what it is that we're actually looking at. So thinking about the swab that we did for COVID or the PCR test that we would do for Zika. All these tests have to be conducted before we can actually begin to treat something because we need to know what it is that we're treating. The next step is to determine what the case actually looks like. This means defining the case. So what symptoms, what incubation period, what consistency. We're looking at, determining between a loose definition and a more strict definition. So thinking about all the diseases that can cause nausea or diarrhea or fever, we would probably want to make a more strict strict identification so that we can narrow it down to a specific disease. So looking at, does it happen within 3 hours of exposure? Is it 24 hours of exposure? Is it 48 hours of exposure? Once we have determined what is a case, we then have to consistently apply this definition every time. Because once we have defined a case, we then begin to record information. And it is critical that we identify the number of cases accurately so that we can accurately calculate the attack rates. We need to know how fast a disease is spreading and how quickly it is moving through a population. Now, in addition to the reported cases, we may also reach out to physicians, clinicians, other health organizations such as emergency room departments, public health clinics, in order to determine whether or not they have seen people with these symptoms so that we can determine whether or not they meet the criteria for a case. The next step is to perform descriptive epidemiology. Now, this is where we're going to orient the data according to person, place, and time. And we're going to talk more about this later. But we're going to be looking at what percent of the population has this disease in this period of time. We then develop hypotheses. Now, the hypotheses should concern the source of the outbreak and the mode of transmission. So thinking about the mode of transmission, is it a vector, meaning that it is an insect like a mosquito? Is it a fomite, meaning that it's like a surface? Is it a vehicle like a needle? We need to understand what is actually causing the disease to spread, and that way if we can eliminate that cause, that vehicle, then we can stop possibly the mode of transmission and stop the spread of the disease. We should develop these hypotheses for all aspects of our investigation. Now, once we've developed them, we have to test them and show whether or not that they are consistent or inconsistent with what we know. And there are 6 steps to hypothesis testing. We won't go into all of those today, but we will talk about them at a later date. Now, as necessary, we do have to reevaluate and change our hypothesis as we get new information. So think about how information changed during the pandemic. We saw guidelines being constantly shifted, information that we thought was true one day, we decided was not true the next. This is how we actually continue building our understanding of how diseases work. We refine our hypothesis and we reject any hypothesis that is wrong. Once we have our hypotheses in place, we then begin to compare and reconcile those with laboratory studies or environmental studies. We use laboratory results to confirm findings. So we would use PCR tests to study Zika or dengue or COVID. Environmental studies can also be useful in some settings, especially if we're looking at an explanation for why an outbreak occurred. So think about how we could have an outbreak of salmonella, and we might want to look at the environment to look at, say, spinach crops to see if there were specific geographic locations that spinach came from that were contaminated with salmonella. The next step is to execute control and preventative measures. So the first thing that we want to do is put into place control measures. So maybe we want to set up a quarantine. We also want to make sure that we have preventative measures in place that can help us make sure the disease is no longer spreading. Because remember, when we think about like the chains of disease, the links in those chains, if we break one of the links, we can stop the spread of the disease. After we have the disease under control and we are preventing the spread of it, we then must monitor the situation to ensure that the disease stays suppressed or is completely eliminated. Now, monitoring allows us to determine whether our prevention strategies and control measures are actually successful. Additionally, monitoring will let us know if it is actually contained or if it has continued to spread to other areas. Now, one of the most important things that we do as scientists is actually disseminate findings. If you do not share your findings with other people, then you are not doing science, you are just exploring a hobby. So, one of the last things that we do is communicate our findings. And this is a final report of the investigation that we prepare and we direct to all of those who need to know. It provides a narrative of the investigation, including some brief background. It shows what we actually did during the course of this outbreak. It also uses graphs, tables, and charts to present the data, and it gives us all the data that is pertinent to this investigation, which could include site notes, lab findings, interview information, characteristics of the disease. And we use this data then to prepare a report that lets us compare our hypotheses with the established facts of the case. Now, it's important to note that all of these steps that I've listed are conceptual, and while it seems like it provides a logical progression for the investigation, these steps can be taken out of order, and sometimes, with caution, they should be done out of order.